What is bipolar disorder? According to the DSM, bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. The section of the DSM that covers bipolar is mood disorders, which are referred to as a persistent or episodic exaggeration of mood state. This is different from the normal ups and downs that everyone goes through from time to time. Bipolar disorders are categorized by different phenotypes or levels. Bipolar 1 is more severe. Mood swings cause significant problems. The manic episodes can be severe and dangerous. Bipolar 2 is a less severe or milder form. Some changes in functions are noted, but generally people are able to carry on normal daily functions. Instead of mania in bipolar 2, it is classified as hypomania. Less severe depression periods are also noted, but they tend to last longer than times of hypomania. Psychosomatic is an even more milder form. Hypomania and depression can be disruptive, but the highs and lows are not as severe as the other types of bipolar. The predominant signs in children and adolescents with bipolar are an explosive temper, rapid mood shifts, reckless behavior, and aggression. These shifts can occur within hours or even a less shorter time. The possible causes of bipolar are biological differences, which can be the appearance of physical changes in the brain. Abnormally functioning neurotransmitters is another cause. The cyclic adenosine monophosphate, which is a messenger on the neurotransmitter pathway, has been researched as a possible factor in the etiology or cause. Imbalanced hormones may be involved in causing or triggering this disorder as well. An inherited trait are when the disorder is more common in people who have blood relatives with the condition. The environment can also be a cause where stress, abuse, significant loss, or other traumatic experiences can trigger episodes of bipolarity. Bipolar often develops in late teens or early adult years. At least half of all cases start before age 25. It is also important to note that with this disorder, it is different with each person. Bipolar disorder can only be controlled. It cannot be cured. 1 in 5 people with bipolar disorder commit suicide. Galanter describes in an article in the Journal of the American Academy of Children and Adolescent Psychiatry that the DSM criteria for manic episodes and bipolar disorder were developed for adults but are used for children. It raises questions whether pediatric BD should be defined more narrowly using a more strict application of the DSM. Bipolar disorder can make it hard for a child to do well in school or to get along with friends and family members. Hamren explains that adult and child bipolar are different, and that children may not experience symptom-free periods like adults do. This means that they spend more time in mania and in depression. Their research also states that children have more frequent polarity switches than adults do. Risk factors that could increase the chances of developing bipolar disorder, according to Luttrell, are having a blood relative with bipolar. This is not always the case because some might not develop this disorder, but offspring with parents who have bipolar were a 2.7 times higher factor for developing a psychiatric disorder and a 4-fold higher risk for developing a mood disorder. Periods of high stress that go untreated can result in serious health conditions, including but not limited to anxiety, insomnia, muscle pain, high blood pressure, and a weakened immune system. Major life changes, both good and bad, can trigger episodes. These events tend to involve drastic or sudden changes. Conditions that commonly occur with bipolar disorder are anxiety disorders such as post-traumatic stress disorder, social phobias, and generalized anxiety disorder. These are just a few examples of the anxiety issues those suffering with bipolar can experience. Attention deficit hyperactivity disorder, ADHD. Sometimes individuals, especially children and adolescents, can be diagnosed with both conditions because ADHD and bipolar disorder have overlapping symptoms. Physical health problems can be heart disease, thyroid problems, and or obesity. How is bipolar diagnosed in children? Typically, a clinician's interpretation and application of the DSM's bipolar mania criteria and their own understanding of the literature is how a person, child or adult, is determined to have this disorder. So what are the current treatments? They involve psychopharmacology. Hamren, as mentioned previously, has given insight to treatments in the article Evidence-Based Psychopharmacological Treatments. They list these as the most common. Lithium, still the most prevalent medication used. It affects the flow of sodium through nerve and muscle cells in the body. Sodium affects excitation or mania. Lithium is used to treat the manic episodes of manic depression. It also helps to prevent and lessen the intensity of manic episodes. Anticonvulsants typically used for people with epilepsy or seizures are now being used to treat people with bipolar. Doctors discovered improvements in mood stability in those with epilepsy who took anticonvulsants. Anticonvulsants are used when individuals do not respond well to lithium, but more frequently they are prescribed along with lithium or other antipsychotic drugs to control mania. Anticonvulsants help by calming hyperactivity in the brain. They are usually prescribed for those who experience a rapid cycling, which is having 4 or more episodes of mania and depression in a year. Mood stabilizers or antipsychotics are often used in treating bipolar symptoms. These types of drugs are known to decrease symptoms of mania until usually the other medications like the ones listed already can take effect. Many people concerned with side effects of drugs and medications in general might turn to natural remedies or herbal supplements. Jim Haggerty, MD, wrote about herbs for bipolar disorder for PsychCentral.com. He explains that some herb substances, which herbalists call nervines, can be useful for treating specific symptoms of bipolar. These are among the strongest extracts and could have serious side effects. They are black cohosh, diamana, ginkgo biloba, ginseng, grapeseed oil, gutu kola, licorice, sarsaparilla, and St. John's wort. Although most herbal remedies are deemed safe, some can have very harmful effects if taken along with some medications. So we've talked about symptoms, what bipolar is defined by the DSM, and current treatment options. So what other disorders could mimic the symptoms of bipolar disorder, possibly causing a misdiagnosis of bipolar, especially in children? David M. Margulies and his team did a study to determine if DMDD, or disruptive mood dysregulation disorder, would lower the frequency of diagnosis of bipolar in children and adolescents. Their conclusion was that DMDD does decrease the rate of diagnosis of bipolar in children, but by how much depends on whether history or observation is used. So why isn't this diagnosis being used and put into practice more? For the answers to this and what disorders could mimic bipolar, I sought out a local counselor, Don Starkey, at the Bowen Center in Plymouth, Indiana. He has been with Bowen for 16 years. He has been in the psychology field for 20 plus years. I spoke with Mr. Starkey and asked him these questions and his professional opinions regarding other bipolar issues. Do you believe that bipolar disorder in children and adolescents has been or overdiagnosed?
Yes, I believe it has. If you look at children behaviors and you look at those things, I think you've got to look for other causes first. I want a child to go get a physical. I want to rule out head trauma, concussion. I think environment plays a huge factor. I think is some of the things we've looked at in some of the newer research. I think sometimes video game play can mimic a lot of factors that are going along in those things. Research now reflects that, and the research is now 13, 14, 15 years old running. And I've seen those behaviors, and as soon as you change certain behaviors, those symptoms go away. I know for insurance purposes and those things, sometimes in this line of work you have to give quick diagnoses, but in something like that, I think you've got to take some time and effort.
Okay. What other disorders do you believe might mimic the symptoms of bipolar disorder?
Sleep apnea definitely comes to mind. If somebody is sleep deprived for a period of time, they're going to have irritability, edginess, explosiveness, which a lot of people quickly assume is not. What I want to look for is if somebody continues to have sleep problems yet has extreme energy consistently, that's a little bit more mimicking that bipolar symptomology. I also want to look for issues of more major depression, looking for that. ADHD can throw in those factors. So I think really fine-tuning those diagnoses before I'm going to jump to conclusions of a bipolar and looking at that. Research indicates that a lot of people were misdiagnosed with bipolar and were ADHD and vice versa. And the complexity is if you try to medicate for somebody who legitimately has bipolar, you medicate for ADHD, you're going to make the symptomology worse for bipolar. So you've got to be cautious with those things. The other thing is looking at some of the other disorders too. I've watched where autism was misdiagnosed and looking at that. So I think you've got to be well versed in a lot of different situations and diagnoses and kind of rule those things out. But also as I'm dealing with the symptomology, it's like peeling back the layers of an onion to fine tune it before I go with that.
Okay. What are some of your thoughts about the new classifications that might be coming out in the new DSM?
Well, it'll be interesting to see when the book is finally done and out, and we'll spend some time, I know, as a center kind of talking about it and getting some education on it, but also right now we're not able to use those new diagnoses. Insurance companies, pay sources don't recognize it, and because the DSM-5 has been out there, there's still a huge debate with it. So in this line of work, you got to go with what's in print right now and move on from there. So it'll be interesting to see, hopefully within the next year, that it's out, and we'll go from there.
Okay. All right. Again, this is Dawn Starkey from Bowen Center, counselor at Bowen. And Dawn, thank you very much.